Hantavirus is actually a group of viruses, and they're spread out across the whole world. They're spread by close contact with rodent excretions. And so typically the classic thing is aerosolized urine, dried up urine. You go into a cabin, you go and sweep the floors, and you breathe the aerosolized urine and you breathe in the virus. That's by far the most common mechanism to be exposed to these hantaviruses. Out of this big group of hantaviruses, actually Andes virus, which is the one that's been on the cruise ship, is one of the only ones that we know of that can actually be spread human to human. So it's actually a kind of a rare kind of thing. So typically we get called when people get really sick and no one knows what's going on and they have a fever, and so they call infectious disease. And so in a case like this, the things that would maybe set off your thinking would be someone who's probably relatively healthy, but now is suddenly presenting with what we call acute respiratory distress syndrome, where they just have sudden fluid leak into their lungs with a high fever, low platelets, and then actually can have some abnormal liver function tests. And then what's interesting is some patients with the severe disease will develop an unusual or atypical lymphocyte pattern on their blood testing. And so all those can be clues that you might be dealing with what we call a zoonosis or an atypical infection. And so as an infectious disease doctor, if you saw that pattern, you would start ordering testing for kind of some of your atypical infections, which would include the hantavirus. The best time to see a doctor is if you're having a high fever with severe body aches. And with some of these, there's what we call warning signs, meaning something that just doesn't quite fit, right? So if you have influenza, you have a little bit of a fever and a runny nose, okay. But if you have some warning signs like abdominal pain or diarrhea with the high fever and body aches, those are kind of unusual things. Or you notice a skin rash, or you're getting confused or kind of having trouble remembering things, or your family's noticing you're getting confused. Those are all times to go see a doctor.